I'll mute until you're done.
Okay. Right. Hi, everyone, and thank you for joining us today for our webinar. Before we get started, I'm just going to touch on a few housekeeping things. I'm Sarah from the California WIC Association, and I have everyone on mute right now to reduce background noise. If you have a question, please type it into the chat box and we'll answer it as the opportunity presents itself, and then we'll have an opportunity hopefully at the end of the webinar as well to address questions. If for some reason typing into the chat box is a problem, like you're on your phone, you can also raise your hand and then I can unmute you to ask the question out loud. So with that, I will turn it over to Karen.
Welcome everyone, and thanks for joining us for this webinar today. This is our second webinar this spring on improving access to fruits and vegetables. And both the webinars focus on partnerships, and we're really fortunate to have really innovative and creative partners to speak with you today. We have Melissa Akers and Sissy Bonini, who work at the UC San Francisco Center for Vulnerable Populations. And the specific program they're going to talk about today is the Vouchers for Veggies, or EatSF and SF WIC program. It's a partnership with our third speaker, Priti Rain, who's the WIC director at the San Francisco County Health Department WIC program. And this program is a few years old and it has some really great outcomes. It's very data driven and built on really strong, innovative and collaborative partnerships with the goal of getting produce to women in San Francisco, particularly pregnant women. And we just think that this is a really great model program to share with you all in the hopes that there might be something you can take away from this for your communities. And without taking up their valuable time, I'd like to welcome Melissa and Sissy. You're welcome to put your questions in and we'll make sure to get all your questions answered. Thank you.
Great. Thank you so much, Karen and Sarah, for that introduction. And thank you for the Cal WIC Association for hosting this webinar. We're delighted to be presenting on Vouchers for Veggies, EatSF, and SF WIC, and our efforts to work together to improve dietary intake and health outcomes during pregnancy. So we're just going to get right on to it. So today's agenda, we're going to talk about the overall Vouchers for Veggies EatSF program model, and then we will drill down specifically to the components of the partnership between EatSF and SF WIC. We'll share some of our program outcomes. We'll talk about some lessons learned. I'm sure for a lot of you WIC folks out there, you might be interested in some of the details of that. So we'll go into a little bit of that. And then we're going to discuss some next steps and opportunities and then leave plenty of time for question and answers. Okay, so just a real brief background of who we are. Vouchers for Veggies, EatSF, we're a healthy food purchasing supplement program. We were launched in 2015 specifically to address food security and health disparities in San Francisco. We received some seed funding from a local funder, Hellman Foundation, and from the San Francisco Department of Public Health. We started off as a small program, around 250 households, but we continued to expand over time, and now we're up to about over 5,000 households that we serve annually. In 2016, EatSF and San Francisco WIC partnered together, really in an effort to improve food security for low-income pregnant WIC participants. The program has since grown quite a bit, and in 2018, San Francisco also passed a sugary beverage tax, which we also have received funding for this program from the sugary beverage revenues. Just a little background for Vouchers for Veggies. That is an umbrella name for our program. In San Francisco, it's called EatSF, but we have also expanded and replicated our program in Los Angeles and Colorado. So that's a little bit of our name. And as you mentioned before, EatSF is a program of the UCSF Center for Vulnerable Populations here in San Francisco. Okay. we'll talk about this for those of you that are on this webinar that are so that are WIC folks, you know this so well, but we just like to always bring this up because this is really the root of why we're here. What is the problem that we're trying to fix with programs like EatSF, vouchers for veggies? And it's really this logic model, the high rates of food insecurity in San Francisco and in the United States. And of course, this data is a little old because now with COVID-19 and what's happening now, I don't even know what the current rates are. So this is actually already slightly outdated. But this combination of high rates of food insecurity, lack of affordable healthy food, that's the high cost of healthy food, plus the lack of access in particularly in food deserts and rural areas, leads to this poor dietary intake. And as we know in America, 1 in 4 low-income families report 0 weekly purchases of fruits and vegetables. So that's quite stunning. We know that kind of poor dietary intake leads to high levels of chronic disease, and poor diet is now the #1 cause of death in the United States. We also know that we spend so much money treating these chronic diseases instead of preventing these diseases from occurring. So in United States, we spend over $500 billion in healthcare costs, again, treating these diseases and very little in prevention. Preeti's going to talk specifically about food insecurity and pregnancy.
Thank you, Sissy, for providing that rich context and background. And good afternoon to everyone. My name is Preeti Rani. I am the WIC director for San Francisco WIC. And a huge thank you to CWA, Sarah and Karen, for providing us this great platform for sharing some of the work that we've been doing with EatSF. So while Sissy covered the health impact of food insecurity in general, I wanted to speak to the impact of food insecurity specifically on pregnant people. The health implications of food insecurity in pregnant people is not limited to the mother, but it is intergenerational. And some of the impacts include low birth weight, birth defects like cleft palate and spina bifida, inappropriate weight gain during pregnancy, so either gaining too much weight or too little weight, impact on infant health, growth, and development, increased rates of gestational diabetes and preeclampsia. And also, it impacts mental health issues such as perceived stress, anxiety, depression symptoms, and loss of control over what they can do. So really broad range of health and mental health implication due to food insecurity that we see playing out every day with our pregnant population. You can go to the next slide. Sissy, you want to take on?
Yeah, sure. And so in you know, every county, every city is a little different. Again, these numbers I want to say are going to be possibly outdated due to the current environment. But we know that even in wealthy cities such as San Francisco, there's enormous amounts of poverty. 1 in 4 folks are estimated to be food insecure based on income alone in San Francisco. Over 7,000 households with children are living in poverty. We see these huge barriers to healthy diets, including the high cost of fruits and vegetables, which are in San Francisco 23% higher than the US average. And that also combined with very high housing costs in places like San Francisco and LA and really across the country. We also have some food deserts, neighborhoods such as the Tenderloin District, which has no full service grocery store and is a very, very densely populated area. In addition to that, you know, we're talking about the fact that 44% of low-income San Francisco residents report that they can't afford nutritious food. This all is some of the challenges that we're trying to work with these programs. So again, like I mentioned, EatSF was really designed specifically to address these food security issues in San Francisco. And the program is really a solution to activate this healthy eating and to really make healthy food more accessible and affordable for a lot of our low-income neighbors. It's when we look at the program, it's really a triple aim program. This is very familiar, I think, for folks at WIC again, that the big goal is to help folks develop healthy eating habits through our program. We'd also like to see an increase in food security. But the other thing is that we've set up a vendor network with EatSF, specifically in underserved neighborhoods. So we're really focusing on neighborhoods like in San Francisco Tenderloin, the Bayview District, the Mission, Soma, OMI, these neighborhoods that typically have very high concentrations of low-income populations and very low access to healthy foods. So a huge part of this is the economic driver of economically supporting these healthy retailers and helping at scale, help them drive the supply of fruits and vegetables into these neighborhoods.
Hi everyone, this is Melissa Akers. I'll jump in for a few slides here so Sissy did a great job of really laying out the background and the context of our program and why our program exists and what we're trying to do. So here it is, really just simply how does our program work? And so this is describing our general EatSF program, and we will talk a little bit later. We'll get into more of the specifics and details about the adaptations and the flexibilities that we've made to really integrate our program into the WIC model. So it may look a little bit different, but in general, what we tried to do is create a program that was streamlined and as easy to use for the folks that are distributing the vouchers, the folks that are receiving the vouchers, the vendors that are accepting them, really trying to make it a streamlined and user-friendly process as possible. So you'll see here on this flow chart is the way that it works is simply that eligible participants, they enroll not through us as the Vouchers for Veggies or the EatSF program. What we've tried to do is really make a community-based, a community-driven program where we are not trying to reinvent the wheel, or what we're trying to do is really leverage the existing trusted relationships with the WIC staff, the case managers, the social workers, those on the front lines who already know their patients or their clients and have those established relationships. So we work through partnering organizations such as senior centers, low-income housing, community clinics, and WIC clinics. So participants enroll through a partnering organization. Once they've enrolled, they will receive, it's a 6 to 9 month program. We've developed it with that period of time, really so that people can start to develop those healthy eating habits. So every month they will receive from where they enrolled, from their healthcare provider, let's say, they will receive between $20 and $40, depending on their household size, in fruit and vegetable, in vouchers that can then be used to purchase fresh or frozen fruits and vegetables from partnering stores. And as Sissy mentioned, we have now over 30 stores in San Francisco, a mixture of corner stores, farmers markets, and large national chain grocery stores. So people enroll, then they pick up their vouchers, they take their vouchers to any participating store that they would like to, that might be near where they live, near their doctor. They buy their fresh or frozen fruits and veggies, and then they take those home and enjoy them. And the store on the back end mails us the redeemed vouchers, or we pick them up and we process them for reimbursement to the store. So that is the life cycle, or the cycle of how our voucher program works. And so here we're going to talk a little bit about who is in our program, who are our EatSF or Vouchers for Veggies participants. So we're really focusing on those who need access to healthy food the most. So we are targeting folks who are low income and who have screened as food insecure using the food insecurity screener. Oftentimes it's people that have a diet-related chronic disease, such as prediabetes, diabetes, obesity, hypertension, and access to healthy food can really make a difference in preventing or managing their chronic disease. We really made a big effort to focus on older adults and those on SSI here in California, because up until a year ago now, up until last summer, so historically for decades, as I'm sure many of you know, that people that were receiving SSI in California, we were ineligible for CalFresh benefits. That fortunately has since changed, but we knew that that was a big gap in the hunger safety net, particularly in California, and those folks in SSI were particularly food insecure, so we wanted to be able to reach them with this program. And then of course, through our partnership with SF WIC, we really are targeting pregnant people, low-income pregnant people who are receiving services at WIC clinics, because as Preeti mentioned, it's such an important, crucial time really to intervene and to improve nutrition and diet for not only mom, but for baby as well. So the impact that we've seen in San Francisco, and now this is not specific to our WIC partnership, this is to our overarching program in San Francisco, is that we are now serving over about 5,000 households annually in our program. And we started about 5 years ago serving about 250 annually. So the program has grown substantially over the last several years. We're now working with over 100 different community-based organizations where people can enroll and then receive their vouchers. As we mentioned, our vendor network is 30 stores and growing, because we really want to make it so that people can shop, you know, have somewhere that is readily accessible and near where they live to be able to shop. We've now infused more than $2 million in fruit and vegetable purchases back into underserved neighborhoods, many of which this is going to corner stores and mid-sized grocery stores. And we've been very supportive and worked incredibly collaboratively with healthy retail initiatives in San Francisco to support work that they are doing to work with corner stores to help them be able to sell produce better. So we really see ourselves as complementary with other initiatives and efforts going on. And Sissy talked about soda tax funding and how we are recipients of that.
Great. And so one of the questions of programs like this is, well, does it work? I mean, some of our goals was to increase food security and impact dietary intake. And the answer is yes. And as Karen mentioned earlier, we here at Vouchers for Veggies EatSF, we do a lot of different types of evaluation. We use kind of multi-interventions to test our findings. Most of the cases, we use a pre-post survey with validated fruit and vegetable screeners and the food security screener. We also do focus groups and individual interviews. And then we've also done, I want to say that this, what we're talking about right now, the results is of our more broad program. And we drill down specifically, we've done a comparison group research study specifically with our pregnant pregnant WIC participants, and Melissa will be sharing those results a little later on. So these are our broader results of the program, and they really are encouraging in the sense that these kinds of healthy food subsidy programs work. And our folks from pre to post, participants increase their fruit and vegetable intake over a serving a day, which can have immediate health impacts on folks. And if sustained, can actually result in a 10% reduced risk of early death. In addition to that, folks also self-report some dietary changes. So we see 91% of folks are eating less unhealthy food, less junk food. They're reporting improved health. And we hear this a lot from folks, and I'm sure your WIC folks that are working the front lines hear this all the time. The improvements with mood and digestive systems, and just getting that healthy food in your body and for your family. Also, the increased awareness of the importance of a healthy diet, more confidence in their ability to buy healthy food on a budget, and of course, the fact that they're just eating more fruits and vegetables. Does it improve food security? Yes, it does. 39% of our folks increased their food security status at least one level. 28% reported they extended their monthly food budgets by at least 1 month. Overall, the prevalence of food security increased by 13%. What is pretty amazing about this is not so much these stats, but the fact that this intervention is pretty cost effective. We're talking $20 a month for a single or couple, and $40 a month for a family. So it's not a high cost intervention, but it seems to have very promising indications on food security. Also talks about the level of food security of the folks that we are reaching with the programs. So then the question becomes, what happens? Our program is, as Melissa mentioned, is 6 to 9 months. And again, the idea is people get in the habit of eating healthy fruits and vegetables and really integrating them into their diet. But what happens when they're no longer receiving their vouchers? And so we tested folks 6 to 12 months after folks were out of the program. And this is also very encouraging. We found that 83% of participants maintained positive dietary changes as a result of the program. They continued to eat less junk food. They continued to eat more fruits and vegetables. They really understood that health aspect of healthy eating. But this is what's really good. 53% of our folks maintain the same level of fruit and vegetable consumption as they did in the program, outside of even despite the fact that they were no longer receiving vouchers. So that's great. So we took a little deeper dive into that, and we're like, okay, so of these folks, like who were the folks that were able to adopt these healthy eating changes, and who were the non-adopters? And we looked at some characteristics, and we found that those that were able to continue their fruit and vegetable consumption, they really understood the health impact of fruits and vegetables. They prioritized them into their budget, and they really worked to find different sources of healthy foods, such as really going for vendors that had cheaper produce and looking for other sources of food, such as food banks. Those that were non-adopters or were not able to maintain that same level of fruit and vegetable consumption, really the biggest barrier was the financial barrier, that it was just too hard to do it without the voucher. But what was really interesting is that they also perceived fruits and vegetables as a luxury item versus the adopters that really saw it as a necessary health need. Additionally, I do want to say one of the things we're also pleased about was that 94% of folks continued to report that they were more confident in buying healthy food on a budget as a result of the program. So that gives you some idea of some of the efficacy of the program. I also wanted to talk a little bit about some of the program design elements that may not be as obvious in the programming, but I think that have been very helpful in our implementation and our ability to for folks to be able to use the program efficiently. One of the things we did right from the beginning of the program is we used a lot of human-centered design work. Observing how people use their vouchers at the vendors. We made some small modifications to our voucher just so that it was easy. So many folks are speaking, we have multilingual participants here in San Francisco. And so to really bridge that barrier, we've used icons on the voucher. So it's really easy to see what items are eligible, what items are not eligible. We also worked with folks that are specialists in behavioral science. And we really help to bake some of behavioral science nudges around trying to get you to eat more fruits and vegetables into our nutrition education. Again, WIC providers, you guys are so familiar with this. I think you've written a book on this stuff. So, but we've also done some really interesting nutrition education specifically for our voucher program with older adults. And we have a special program called Vouchers for Veggies Gold, which is specifically designed for the health and nutrition needs of older adults. Also, we use some different technologies. We use, again, we're using paper vouchers currently for our program. We use optical recognition software to capture information off the vouchers that we use for our processing for payment, but also for tracking program outcomes. We also use that for fraud control, and we have a number of fiscal controls and some security measures on our vouchers, and we also do secret shopper visits with our vendors to ensure that we're getting the right training to our folks. The program has really built right from the beginning, and we'll talk about this a little more in our partnership with Preeti, about how much we have involved, like really embedded this flexibility in listening. Really, where do people shop? What kinds of culturally relevant foods do we need to make sure that folks are being able to access through the program? How is it working? How is it not working? So we feel like that those communication loops are super integral to the program design and making sure that we're moving towards our targets.
We do have a few questions. I don't know if we want to take an opportunity to stop and address those, or if you guys want to keep going.
I'm good with some questions. Are we good? Let's do it.
Okay, so if the pregnant women if the pregnant women are receiving this voucher, will they also be eligible for the upcoming $28 of farmers market vouchers?
So the way we decided to handle that is since pregnant moms are getting this benefit, we decided to focus the FMNP checks to our older children, to toddlers. So we are focusing, that's just how we've done it for the past couple of years now, and it's worked well. So that way we are able to spread out the resources broadly among the families with providing opportunities to get additional produce to more families that we can serve. So right now we're focusing on children for our FMNP checks.
Okay, and how many people were surveyed for your data on the long-term dietary changes? What type of study was it, or just subjective answers?
For the long-term dietary changes, we did, it was like a pre-post. So we knew folks had been in the program, so we knew their before the program, they're during the program, and then we did it 6 months after. So we used the same fruit and vegetable screeners and the food security screener. And then we did a lot of also qualitative interviews as well. So we did a bunch of qualitative data analysis, but that was the hard numbers there.
That was it for questions right now.
Great. So let's talk about, so we're talking about the more broad EatSF program design, which is very similar as most Veggie RX programs or healthy food supplement programs have incredible similarities to WIC, because it's all the same program model, it's just slight variations of it. But let's talk about very specifically now how we work the partnership with pregnant folks.
Okay, so I'm going to briefly touch on how the partnership got started. So the partnership started with the MIHA data that was published back in 2015-16, which really highlighted the disparities in food insecurity rates among pregnant people in San Francisco who were enrolled in WIC. So while 8% of all pregnant people in San Francisco were food insecure, more than 20% those that enrolled in WIC reported food insecurity. So there was a huge disparity among those that were enrolled in WIC, and that was used as a proxy for low-income families. So in 2016, the Department of Public Health initiated this partnership between EatSF and SF-WIC with two main objectives. The first was with the goal of reducing disparities in food insecurity rates. And then the second one was improving birth outcomes for low-income pregnant people in San Francisco, because that is another initiative that is in San Francisco around preterm birth and reducing the rate of preterm births within, especially within African-American women here in San Francisco. And so we're trying to integrate all of these different approaches to this collective approach of improving health outcomes. So when the partnership came to be, the EatSF and the WIC staff worked extremely closely to train, provide technical assistance and troubleshoot. As you can imagine, back then, it was a voucher program that was embedded into a voucher program. And so there were a lot of logistical details that needed to be planned and worked out. And it was through this team effort and communication, constant communication between the WIC team and the EatSF team that we were able to get the program to where it is today. There was buy-in from the team members right from the get-go. They had since they were in the front line and doing this work, they had plenty of opportunity to provide feedback, which were very, very generously accepted by the EatSF team and really integrated and making sure how we can improve the program better, not just for those that are implementing it, but also for the families that are availing this resource. So we implemented the program in all 6 of our WIC sites across the city. And the participant received $40 per month of the fruit and vegetable vouchers for 9 months. Back when we started in 2016, it was 6 months. And very quickly, we realized that many of our participants were disappointed once they weren't receiving the vouchers anymore, and they just had the baby. And so we decided to extend it to 9 months to roughly cover the first 3 months postpartum. So they have that support right after they have the baby as well. Since 2018, we have also engaged Native American Health Center WIC. That is another WIC agency that has 1 clinic in the city. So we made sure to reach out to them as well to make sure we are capturing every mom that is on the program that is in the city. So that was an engagement or partnership that started in years after we implemented with the department's program. Next slide, please. So all the work and the programs in the city have an equity-focused approach, and this program was no different. While these vouchers now are available to every pregnant mom in the city that's enrolled in WIC, our focus continues to be Latinx, African American, and Pacific Islander pregnant people to address the health disparities. In San Francisco, these communities are disproportionately have a higher rate of food insecurity. Black babies have a higher rate of preterm birth rates. These communities receive different rates of prenatal care, and they also have a disproportionately large number of children between 0 to 18. And so having this equity lens built in throughout our programming was extremely essential and a very key value for us. And everything that we do is through that lens to ensure that we are really intentionally engaging the populations that are that have the biggest disparities. Next slide, please. So the partnership certainly has evolved and has come a long way since we started back in 2016. Like Cicely mentioned, EatSF used the human-centered design process to integrate EatSF into WIC workflows with the goal of reducing the administrative burden on the program. So as you can imagine, there were certainly some challenges in the beginning, and especially because there are so many different processes that happen or workflows that are built into the WIC program to begin with. And so there was another program that we integrated into it. And so there were a lot of logistics around when are these vouchers going to be offered, you know, what kind of education, you know, how is the WIC appointment going to match with the EatSF benefit appointments, and so on and so forth. So there was a lot of nuanced processes that we needed to work out. We also had some burdensome paperwork. Since WIC is so integrated, or the integrity component in the program is so deeply rooted in the program, we had extraordinary amount of unnecessary paperwork that EatSF really didn't need. And so we really took a very hard look at what is it that we were documenting and the reasons why we were documenting, what we were doing with that information. And while doing that, we were able to really eliminate a lot of the additional paperwork that really wasn't required. And then there was a lot of effort that was put towards understanding and listening to staff and their demands and their competing priorities. When you have a long WIC appointment, you know, parents and families get antsy, they want to leave, and then on top of that, although they want the benefit, there's an additional paperwork. And so we really gave a hard look at how the workflow happens, when would be the right time to give them, in an effort to make sure that the participant has a good opportunity to participate, and the team member did not feel pressed in the midst of everything else that they have to do for WIC, that now they have to offer this program as well. Some of the solutions that were implemented, as I mentioned, we eliminated a lot of the unnecessary paperwork, logs, and you know, we were writing down all these additional information, additional notes in MIS that really weren't looking at them. And so we were able to eliminate many of those. And really, giving a hard look of streamlining all the processes. And this included, initially the vouchers were $5, and staff had to write all the dates on it. So it was a long and a very labor intensive process. And so we asked EatSF if they could increase the voucher value to $10 instead of $5. Because a lot of and then they looked at their data and they found that most families were using $10 at every given shopping trip anyways. And so they were able to increase the denomination. And now it's gone to where they're all pre-printed, so there's no writing or none of that happens. It's just a matter of handing it out. They also helped us shorten the survey because, again, we wanted to decrease the paperwork burden for the participant as well. The program information is given in multiple languages. We have so many different languages that we serve here, but predominantly our main languages are English, Spanish, and Chinese, and we have all of our materials in those languages for good communication. And then with EWIC on the horizon, we really started to think through making sure that this program is going to be successful even as we go through the EWIC rollout. And that's when we brought in the WIC interns into the program to do the administrative component. And that gave a breather to the staff so that they could focus on the rollout of the new project while we're still able to enroll WIC participants into EatSF and continue the program successfully. At the bottom line was definitely a lot of communication, very strong communication, teamwork, and really this commitment to make sure that our families are getting the benefit and this valuable resource in a way that's seamless and really easy to use. And so the program has evolved quite a bit, especially from the WIC's perspective to where it is today, where we feel very strongly on how it's going on today, and then the plans to come in the future. Next slide, please.
Great. Thank you, Preeti. So that really, I think that shows you are so right that we have come a long way. And so we touched on the impact of our overall program before. And so now we're really going to talk about the exciting results and the impact that EatSF is having specifically on our WIC participants. So since 2016, we have now grown we have now served over 2,500 pregnant people through WIC, and that number is just continuing to grow as our partnership with them continues to grow. And we really now have our overarching goal is that we want to be able to enroll into our voucher program, every single pregnant person that walks through WIC to be connected to our program. So we only expect that number to grow. As we mentioned before, we have our vendor network. Our participating stores continue to grow. And this, I think, is really one of the things that is, because of WIC and because of the WIC staff, their feedback and their advocacy on behalf of their clients. When we started the partnership with WIC, the vast majority of our stores were really concentrated in the Tenderloin, in the Bay, and in the Bayview, because that's where most of the our other participants that we were serving were. And we heard a lot of feedback about, well, a lot of our WIC clients, they might live outside of those areas. They might live in the Excelsior, they might live in the Mission, they might, other places. So we really took that to heart because we really strive to have this program be make things as convenient as possible for people to be able to access healthy food. So that it was a big impetus for us to expand our vendor network and grow, and add on stores in different areas of the city so that people could easily access wherever they might live. We've seen consistently throughout the program a really high voucher redemption rate of 81%. With the caveat that right now we are with the transition to the EWIC card and with COVID and telehealth appointment, virtual appointments, the redemption rates right now are a little in flux, and we are still analyzing the current redemption rates. But across the board, historically, the voucher redemption rates have always been very high at 81%, which is consistent, I believe, with WIC voucher redemption rates, and for produce prescription programs across the country is very high, and a 90+% participant satisfaction rate. And that is, we always strive to maintain a high level of satisfaction amongst our participants. And if it's not high, we want to, get feedback and figure out why and what we can do to change that. So Sissy alluded to this a little bit earlier. So these are, I'm going to share with you the results from our pilot research study. So we really strive to conduct a robust evaluation of this program. And so we conduct pre-post surveys with all, in our larger program, and then also with our WIC participants. This research study, though, was funded. This was in 2017-18. This was funded by the UCSF Preterm Birth Initiative. And this allowed us to take a much deeper, more robust and deeper dive into really examining the impact of our vouchers on WIC participants, specifically on their food security, their dietary intake, and to also look at an exploratory outcome of birth outcomes, including preterm births. And so we had, we did a pre-post study looking at about almost 600 WIC EatSF participants. And our results were extremely exciting. We found major increases in food security, 30% in improvement or increase in food security, a 0.73, so almost a one serving fruit and vegetable intake a day. And then extremely exciting was our results that found that compared to a historical control group from the year prior, that the group that was receiving the vouchers had a 37% lower odds of a preterm birth delivery. So this was all very exciting to us. This is being published this month online as of next week in the Journal of Health Education and Nutrition. And so this pilot study and the exciting results really is allowing us now to do a follow-up randomized controlled trial to really continue to examine the impact of our vouchers. So building on our previous pilot study, we now have funding, and we have a grant from the Robert Wood Johnson Foundation's Healthy Eating Research Program to examine, again, the impact of our vouchers on food security, dietary intake, and birth outcomes for pregnant WIC clients. And we are going to be we're going to be looking at our intervention group of the San Francisco WIC, 400 pregnant moms who are receiving the vouchers, and we're going to be using some control sites with neighboring counties. And our timeline, we had hoped to have this already kicked off and in the field, but as you all know, things are a little bit in flux and changed. The timelines have been changed due to COVID-19. So we are now hoping to kick this all starting in late summer, early fall. And kind of going on more qualitative evaluation results of EatSF and WIC, and we really tried to take a step back and say, we know that things are working, so what is it that's, what are the key components of our program and our partnership that are helping to make this program successful? We really strongly, see our program as complementary. We are not trying to be a new program coming in and pretending to know everything and just start our own nonprofit and say and that we know how to do this better. We're really leveraging the great work that is already happening within all of the WIC clinics. And so we see ourselves as a complementary resource or additional service to all of the resources and services you're providing your clients, and we're an added benefit. We really try to convey wellness and a sense of health and wellness and positivity surrounding our vouchers, and really create this culture of health. And we've seen this time and again that we see our vouchers act as an incentive. It helps to have something oftentimes when you are providing your clients with nutrition education and resources. It helps to often provide the financial incentive. So perhaps somebody's participating in a nutrition education class and they learn about, ways to make healthy blueberry smoothies. And now here comes the voucher that allows them to, the financial means to go purchase those blueberries. And we've really tried to make this of course, a culturally sensitive program where all of our materials are translated into multiple languages. And we get lots of great heartwarming quotes and quotes from participants and from the site staff that we work with. And we just wanted to pull just a few let people get a sense of what we hear about the impact of this program, that they're feeling that because they're eating a lot more fruits now, I feel that my pregnancy has been healthier because of it. And I appreciate the help that they give me and my children. So I'm very happy with EatSF. And I'm a single parent with 3 kids, so it's a serious pleasure for me, and it keeps me from eating candy.
Great. So we wanted to, this is a little bit of a summary format, but we did want to just break out the lessons learned from this. And Preeti and I are going to share this slide a little bit, but I can just talk to some of this is that one of the things that for any partnership is it requires the flexibility and to adjust to different workflows. And we heard loud and clear that from the WIC staff that so much was that how little time they have. So we have to make these efficient, and they have to work for the participants so the participants can do the good work they're doing with the clients. So, I think that that's super important. We are definitely, this flexibility, these communication flows are ongoing because we're going to just see more and more of these challenges with COVID, with remote enrollment, with all of this, with the e-cards coming in, with a lot of confusion with folks about like, wait, I'm on cards now, but what's this voucher? And we have to, EatSF, really try to meld our programming for the best partnership that we can have. So for sure, to keep those kinds of best practices going. The other piece is, Melissa mentioned before, trying to align the network. Easier said than done in terms of our retail network, but as much alignment as possible, because it is difficult for participants when they have two different sets of vendors that they're working with. So more of that, but the more crossover, the better. And I do want to say that we are very committed in really emphasizing the priority for some of our most needy families in the city, and really investing in these interventions to improve food security and health in our communities is super important. So investing in making it happen, but also investing in supporting funds for these programs.
Sure, and just to add to that, I saw a question in the chat, and I think I can address it at this time. It's around funding, administrative funding for this project. And so the city, it is expensive to do business, period, and it definitely is expensive to do business in San Francisco. So the city department pours in hundreds of thousands of dollars in the WIC program already. And so partnering with the community organizations or doing work that is more collaborative really highlights the WIC program in a way that is absolutely critical, and making sure that there is continued support from the city as WIC being an essential and a critical piece in addressing health disparities in the city. And so although we haven't specifically given WIC dollars to this partnership, the benefit that the partnership has brought to the WIC in terms of making sure that the commitment from the city and the department and the critical nature of the WIC program is considered, continues and grows. So every time there is a conversation around food insecurity or services for pregnant people or families with young children, WIC is always at the table. And I think partnerships such as this really help us build that confidence in city leadership and the community in general. And this has been a prime example of that.
Do we want to answer a few more questions right now, or should we wait till the end?
Yeah, we could do it. Yeah, let's do it since we have, especially if it's relevant.
Are these services available to undocumented families?
Yes, they are available to everyone that participates in WIC for the vouchers that are received at WIC offices.
Okay. If clients go over the allotment allocated either with the WIC benefit card or the voucher presented, can they use both and not pay the difference?
Melissa, do you want to answer that one? They have to pay the difference. Go ahead, I'll let you answer.
Yeah, I think if I'm understanding it correctly, I think that they could use a combination if they were at a store that accepted, that accepted WIC and also accepted EatSF vouchers. They could use a combination of those and not have to pay, yes, and not have to pay anything out of pocket. The policy with EatSF that we tell people is that you are, let's say if you have, $40 that you spend in vouchers, but your total comes out to 45, you are, you pay the 40 in the vouchers, and then you pay out of your own pocket or with whatever other funds you have, you pay the difference. So people could technically use both.
And how do vendors get reimbursed?
The quick answer. So we have set up a kind of few different ways, but so the EatSF program we have at UCSF, we operate under a fiscal sponsor, and we sign MOUs, contracts with all of the vendors. We provide them self-addressed stamped envelopes, and or we pick them up. So on a kind of a monthly basis, through whatever time period we've established with the vendors, they mail their redeemed vouchers to us. We work with our fiscal sponsors accounting department to process those redeemed vouchers, and then they will issue them a check, or now we are moving to direct deposit for the face value of the redeemed vouchers that they have mailed in. With the larger national grocery chains, we tend to work through their corporate accounting office. So that looks a little bit different than working with like the smaller corner stores where it's more individual.
Great. That covers all the questions right now.
Great. So we did want to just mention briefly some of our emergency COVID-19 response. And really here at EatSF, immediately after our shelter-in-place orders in San Francisco, we had clinics and partner organizations reach out to us looking for additional resources for their clients and patients. And we were able to quickly get out some nutrition information about like how to stock food in your house that's nutritional, but also we knew because we have these pre-existing infrastructure with our community-based organizations we work with, and with that we're in these neighborhoods that are with our vendor network, we were able to do a rapid response. We did do an emergency voucher that was for all food items except for alcohol and sugary beverages that we were able to actually distribute pretty immediately. And we're EatSF, we're doing about 100,000 vouchers we're distributing in about 8 weeks. And part of the folks that are receiving them are 900 WIC households, where they really focus on pregnant people and families with children under 1 year old. And Preeti can talk a little more about that in the next.
You're muted, Preeti.
You're
Sorry.
Yeah, go ahead.
So when this COVID pandemic started to really, escalate, and EatSF, and there were other responses, philanthropic responses that in the community too, that we wanted to really make sure we were reaching out to and making sure our big families are especially are taken care of. We provided some responses, especially around food, including these COVID related EatSF vouchers. And since we have, again, because the resource that was available was so to speak limited, we really wanted to make sure that we are reaching the most vulnerable populations within our community. So we decided that our focus was our Latinx and our African American community. And the Latinx community specifically, because they were the most, especially with the data that was first coming out, they were the most hit with the COVID crisis. In San Francisco, these families live in very cramped households with many families living under the same roof. So overcrowding, they have inadequate health insurance. They work in industries that require them to go to work and have a higher exposure rate. And so we ran a report in RAD and got the names of families that were, or information of families that were Spanish preferred language, and that was our proxy for, especially undocumented families, and focus on zip codes that serve mostly our Latinx community. And so with these vouchers, we were able to not only take the EatSF pool, but expand that to some of these families that are more vulnerable. And then for our, we also partner with our Native American Health Center Clinic WIC to reach out to the families that they were serving as well. And then we wanted to really wrap our arms around our Black infant health, or Black moms, and we did that through our Black infant health program. And those moms received around 9,000 checks in their $10 denomination, about 100 moms. The Black community in San Francisco is very, very small, and certainly, but the disparities are higher. And so we wanted to make sure that effort was intentional. Sissy mentioned about food deserts, and a lot of our families live in food deserts, and we wanted to make sure with the whole public transportation issues, also we were afraid that they take public transportation, and we wanted to limit exposure, and we were able to partner with Lyft for rides to grocery stores to redeem not just the COVID specific EatSF vouchers, but also the WIC and the CalFresh benefits. And through that, we also were able to really even make our partnership with the Black Infant Health Program even tighter in terms of referral for sustained nutrition and breastfeeding support. There were some DPH clinics too, outpatient clinics, that we were able to push these vouchers out to some of the families that they serve, the WIC families that they serve. And again, that referral stream coming back to WIC and CalFresh to make sure that they're connected to vital programs, to make sure that there is a sustained food resource and a nutrition support that these families are receiving. Next slide.
Great. And I think we talked about this before, but just sort of going into our conclusions, the importance about this current environment, and we talked about this COVID, requires adaptability to these emerging challenges. So really having to look at virtual and remote enrollment, mailing vouchers. We have done a lot of work around retooling our efforts, as every WIC program has, and really looking towards some future opportunities, such as different cards, different delivery apps, some new creative solutions. We'll talk a little bit about that in a minute. So go ahead, switch. This are our conclusions. I mean, kind of wrapping it all together, we just like to highlight the fact that additional resources for fruits and vegetables during pregnancy improves food security, supports healthy dietary intakes, and contributes to preterm birth reductions. Super important evidence backing up the efficacies of these programs. Supporting food purchases may allow voucher recipients to divert income to other expenses, which also support pre- and postnatal outcomes. And exploring new methods of resource and service delivery to maximize efficiency, safety, ease of use, and integration into the new systems is going to be crucial. And lastly, I'd like to just wrap up with some policy opportunities that we have identified as a result of these successful program partnerships. Absolutely funding support and increase to WIC benefits, specifically increased F&V CVV supports for pregnant people. We love to sustain, scale, and replicate these types of programs across the country. And I know I presented EatSF in LA. There's just a lot of interest in these types of models. The other thing that is super important to us right now and going forward is just the importance of, this is a more procedural change, allowing local WIC jurisdictions to supplement the F&V CVV directly on the eWIC card. We love working with Preeti. EatSF is committed, but honestly, if you just take this money and put it on the card and we're out of business with y'all, that's better for the clients, and we should do it. And it saves money and increases client satisfaction. It's more efficient. It's less confusing. It allows for other funding opportunities and is responsive to community needs. Now, I do want to say that doesn't mean that we don't go out and that EatSF doesn't also serve similar pregnant populations through our clinics, through our community-based organizations. We're not leaving anyone out. But the more efficient we are, the better off we are. Thank you so much. Let's open up for some more questions, and if we have time.
Okay, we have one. If the vouchers are lost, stolen, or ruined, is there a replacement available? What's the security on them?
So we do not, they are very similar to our WIC voucher world, unfortunately. We cannot replace them if they are lost or stolen. And that's why even more we're more eager to find a technology solution to this work. But yeah, currently, unfortunately, if they're lost, or we ask them to treat them as cash.
That is the only question I'm seeing right now. Folks, if you have questions, type them into the chat box, or you can raise your hand on the, there's a little hand raising thing, and I can unmute you so that you can ask.
I just really wanted to say thank you for your presentation, all the hard work you've done for these years establishing the program. It takes a lot to build those relationships and working partnerships in different systems, and then show the outcomes. And I think this program and other programs are so important to make system-wide change at all levels. If you think about the spectrum of prevention and how we can really make concrete, sustainable change, it was so evident in your numbers, what a really small amount of money can do for the health outcomes and the economic impact for families. And we know that the WIC benefits with the rising cost of housing and what it takes to be economically secure. WIC benefits need to be increased, and we know that people really appreciate, and your data shows what happens when you give them a little bit more money to buy some fruits and vegetables. And so we really appreciate that you've taken the time to do this, because this is the kind of policy advocacy work that we need to hopefully make, the ripples across the systems continue. And certainly, the discussion about electronic linkages for the benefits is important. I mean, we're seeing right now in the COVID crisis that technology is our friend. We just launched another spaceship into space, a week ago, and we should be able to do this type of horizontal integration and technology linkage. So we appreciate you, showcasing these really important underlying changes that we need.
So we're getting a few questions about, is there a way this program can be expanded to other Bay Area WIC programs? And another, I see on your website you provide consulting for other agencies hoping to start a similar program. So what's involved there? So folks want to know about cost and what that includes and how they can get in on it.
Yeah, I would definitely say reach out to us. Our websites, our email addresses are posted right now, but for sure reach out to us and we can talk about details of that. Is there a way programs can be expanded? Yes, the tricky part is always going to be, as any program, funding, right? So, but I think we are committed to help. I think some of our program outcomes, some of our, we're definitely want to be in dialogue about how to make that happen.
The one thing I would say, so the funding initially started with the mayor's ad back funding, and then the sugary beverages money that was coming in, like Ceci mentioned. So, another thing I would encourage, local WIC programs is to keep an eye on your counties or your city's budgets and what the allocation and where it is. And as you see opportunities, because this is a very, it's a very tangible, it's a circle, right? Like you give the fruits and vegetables to the families, but the money rolls back into the economy. So these types of interventions are politically popular as well. And so I encourage you all to take a look at some of the where the funding is going around chronic health prevention, and maybe having opportunities for funding come through that way. So just a thought.
Not seeing any other questions right now.
I just wanted to comment, you had a lot of pretty detailed grocer involvement. Do you recall any just sort of anecdotal feedback from them? Because it's a really great comment on our grocers to be engaged in this program, and just those public-private partnerships, especially with private corporate businesses or small grocers, is really good to see.
Yeah, I mean, I think we have not only anecdotal, but we've got some we do a vendor impact analysis that we do ask our vendors, and definitely results. 100% believe that Vouchers for Veggies is a good resource for the community. 88% are seeing more or repeat customers or new repeat customers. 89% reported selling more fruits and vegetables. 72 report increased profit. For our smaller stores, 1 out of 2 stores reported increased produce restocking. That's exactly the kind of thing we like to see.
Good, yeah.
So we know that some folks at scale, the program at scale, they'll have 1 produce delivery a week, and they'll go up to three a week with our program.
Yeah, and that's really good on those small local retailers, because I remember when the Healthy Local Retailer Initiative started, maybe over a decade ago, that was a problem for them, was to have enough customers to justify their produce purchases, so the produce wasn't going bad. So that's a really nice thing, looking back, to see where you've come on an issue like that made it, difficult to get produce into those local small stores. Congratulations.
Thank you.
All right, I'm still not seeing any new questions, so I think we can wrap it up. Everyone, thanks so much for joining us. And then the emails are all up right now. If a question occurs to you later, I'm sure our lovely panelists would not mind at all if you reached out. And with that, enjoy the rest of your day. Bye, everyone.
Thank you so much. Thank you for hosting us.
Thank you.
And thank you for everyone who attended. Thank you so much.